Hi, my name is Meron, and today I will be speaking about substance abuse, specifically heroin. Heroin, also referred to as dexamorphine, is an opioid compound derived from the dried sap of the opium poppy plant. Heroin is considered an illegal and highly addictive drug, according to the National Institute of Drug Abuse. Heroin is typically sold as a white or brown powder mixed with substances like sugar, starch, and is primarily sourced off of South America, with some supply coming from Southeast Asia, and is mostly dominating the U.S. markets east of the Mississippi River. Heroin is a Scheduled 1 substance and is of the opioid class. Opioids, which come from various sources. Opioids come from raw poppy seeds and poppy seed products such as in teas and smoking kits. Heroin can also be found in semi-synthetic drugs such as morphine and oxycodone, and synthetic drugs such as methadone and fentanyl. Heroin can be injected, sniffed, snorted, or smoked. In fact, sometimes it's even mixed with crack cocaine and is called speedballing, which methods quickly deliver drugs to the brain, increasing its addictive potential. History of abuse. Heroin was first synthesized in 1874 by Charles Romley Adler Wright and later resynthesized by Felix Hoffman at the Bayer Pharmaceuticals in 1898, where it was initially marketed as a non-addictive cough suppressant. However, it was quickly halted as it was found to have addictive properties, and it was seized in 1913. Opioids have been used for centuries to help treat pain, diarrhea, tooth decay, insomnia, cancer, and chronic pain, but they are also known to be very addictive and have contributed to the widespread abuse seen in America. Opioid abuse epidemic has been a major global public health care crisis. In 2021, drug overdose deaths in the U.S. reached a record high of over 107,000, with opioids playing a significant role. The CDC identifies three waves of the opioid epidemic: prescription opioids, heroin, and synthetic opioids like fentanyl, with mortality rising sharply after 2013. About 1 million Americans used heroin in the past year, with the highest rates among adults ages 18 to 25. Nearly 80% of heroin users reported prescription opioids before turning to heroin. Most of the time, they've gotten prescription opioids from family members or friends, or even were prescribed it initially for treatment of pain. Using opioids for more than 3 months increases the risk of addiction by 15 times. Heroin use disorder affects approximately 691,000 Americans annually, with the initiation often linked to prescription opioid misuse. Risk factors/vulnerable populations associated with abuse of heroin. Heroin use and overdose deaths have significantly increased across demographics since 2000, especially amongst white, non-Hispanic adults and women. A significant risk factor is a history of prescription opioid use. Additionally, the Northeast and Midwest of the U.S. have higher rates of heroin use and overall overdose deaths compared to other regions in the U.S. Poverty, having family history of addiction, lack of education, unemployment, and social isolation increase the vulnerability to heroin abuse. Key structural factors contributing to opioid abuse include an aging population with increased pain and disability, economic hardship and declining social cohesion, and rising mental health issues leading to at-risk individuals seeking opioids for treatment. Short-term and long-term side effects. Short-term side effects of heroin use include an initial rush or surge of pleasure. Users may experience skin flushing, dry mouth, heavy limbs, itching, nausea, and vomiting. After the initial effect, users typically feel drowsy for several hours with a slowed breathing rate. Long-term effects. Long-term effects of heroin can cause liver, kidney, and lung disease, mental disorders, abscesses, and other health problems. Injecting heroin increases the risk of infectious diseases such as HIV, hepatitis, and bacterial infections, as well as collapsed veins. Repeated heroin use leads to tolerance requiring higher doses and can cause withdrawal symptoms such as restlessness, muscle pain, diarrhea, and cold flashes. Chronic use often results in heroin use disorder, where individuals continue using drugs despite serious health and life consequences. Signs and symptoms of heroin abuse upon assessment. Physical symptoms that are often seen with heroin abuse are pinpointed pupils, drowsiness, slurred speech, and slowed breathing. Behavior indicators observed are euphoria followed by lethargy, neglect of responsibilities, and secretive behavior. Psychological effects include mood swings, depression, anxiety, and intense cravings for the drug. Tolerance to heroin increases the need for larger doses, and withdrawal symptoms often drive for continued use. Potential use for overdose or use of suicide, weapon of choice. Heroin users are 14 times more likely to die by suicide, with death rates 13 times higher than their peers and a significantly higher prevalence of attempted suicide. The increased risk of suicide in individuals with opioid use disorder related to heroin use is linked to factors such as social disadvantages, childhood trauma, a lack of family support, and a history of abuse, significantly raising the risk for suicidal behavior. Heroin's ability to relieve emotional pain can reinforce negative coping, increasing the risk for suicidal behavior as individuals may see suicide as the only escape from their distress. An example care plan for a patient with a diagnosis of opioid use disorder, heroin, severe. The problems would be active heroin use, risks of withdrawal, medical complications, social and occupational dysfunction, and a high potential for relapse. Interventions include medication-assisted treatment, MAT, which involves initiating bupropion/naltrexone or methadone therapy with daily supervised dosing and regular urine drug screens. Medical management includes obtaining a baseline physical exam, labs, monitoring vital signs, screening for infectious diseases such as hepatitis and HIV, and treating comorbid conditions. Psychological support include weekly individual counseling, group therapy, recommended NA or AA meetings, and family therapy as needed. Goals for a patient with heroin use disorder are short-term includes stabilizing withdrawal symptoms, achieving initial abstinence, and engaging in a treatment program. Long-term goals focus on maintaining sustained abstinence, preventing relapse, and improving social functioning / returning to work or school. Referrals should include an addiction specialist, mental health counselor, social worker, and a primary care provider. Follow-up should include weekly visits initially, transitioning to monthly once stable, with emergency contacts provided, and relapse prevention planning. Pharmacological treatments. Medications for opioid use disorder work on the same opioid receptors as addictive drugs but are safer. There are 3 types of medications for opioid use disorder: antagonists that activate opioid receptors, partial antagonists, agonists that produce a small response, and antagonists that block receptors and reduce the rewarding effects of opioids. Effective medications for opioid use disorder include methadone, a slow-acting opioid agonist, bupropion, a partial agonist, often combined with naltrexone and Suboxone, and naltrexone, an opioid antagonist, each with different mechanisms and benefits, including the ability to reduce cravings, prevent withdrawal symptoms, and improve treatment adherence. Additionally, medications like lofexidine can help alleviate opioid withdrawal symptoms during detoxification. Non-pharmacological treatments. Behavioral therapies such as contingency management and cognitive behavioral therapy are effective in treating opioid use disorder, particularly when combined with medications. Contingency management rewards patients for negative drug tests, while CBT helps modify drug-related behaviors and build coping skills with treatment approaches tailored to individual patients' needs. Patient education and referral. Heroin is a highly addictive opioid with several health risks, including overdose, infectious diseases, and long-term organ damage. Treatment options such as medication-assisted treatment, behavioral therapies, and support groups are essential for recovery, while developing coping strategies and avoiding triggers can help prevent relapse and promote long-term sobriety. A lifetime of treatment, self-care, and lifetime modifications are all necessary for heroin addiction recovery. If someone overdoses on heroin, seek emergency help immediately and administer naltrexone or Narcan, which can reverse the overdose and save a life if given promptly. Addiction is a medical condition, and seeking help from a healthcare provider, addiction specialist, or greater support groups is the first step towards recovery. Referrals should include an addiction specialist, a mental health counselor, a social worker, and a primary care physician. Follow-ups. Follow-up includes weekly visits initially, transitioning to monthly once stable, and once with emergency contacts provided and relapse prevention planning intact. Regular follow-up appointments are essential to promote recovery and monitor patients' progress and adjust the treatment plan as needed. In conclusion, heroin abuse is a serious chronic condition with devastating physical, psychological, and social consequences, including overdose and infectious diseases. Effective treatment involves a combination of medication-assisted treatment, behavioral therapies, and psychosocial support to address both the physical dependency and the underlying cause of addiction. Ongoing monitoring, support, and relapse prevention are key to maintaining long-term recovery and improving the overall quality of life for individuals affected by heroin addiction. Thank you.